Hello everyone, I am Shahpara Nawaz, and today Dr. Jane Wilbur and I will be presenting the findings on the impacts of climate hazards on sanitation and personal hygiene of persons with disabilities in Bangladesh, a mixed method study. This study is a collaborative study being done by icddr, LSHTM and World Vision, and this study is funded by Water for Women. World Health Organization estimated that approximately 16% of the global population has significant disabilities. Nearly 80% of people with disabilities live in LMICs where access to wash services are limited. Additionally, 142 million people with disabilities depend on caregivers for their daily activities, including support for water, sanitation, and hygiene. And they face greater risk of experiencing negative impacts of climate hazards due to their existing vulnerabilities, which affects their ability to express their wash need and access critical safety information during climatic events. A recent nationwide population-based survey in Bangladesh revealed that 8% of the total population has disabilities. Bangladesh is one of the most vulnerable countries to climate change, with 90 million of its population living in high climate exposure areas. If we look at the map of Bangladesh at the right side, we can see the whole country is vulnerable to cyclone, flood, and drought. However, the impacts of climate risk on health and well-being are documented, but the probable disproportionate impacts on the lives and wash-related experiences of people with disabilities are not. Therefore, we aim to strengthen evidence about how climate hazards affect the health and well-being of people with disabilities in Bangladesh through risks to sanitation and personal hygiene. As I have mentioned, this is a mixed method study. The quantitative component included a population-based survey across randomly selected 32 districts of the country. The green marked area in the study area map at the right are the areas where surveys were conducted. The sample size was 1,021 people with disabilities involving both men and women identified through Washington Group short questionnaire set, and 909 people without disabilities were also surveyed as age, sex matched community control participant. For qualitative component, we conducted in-depth qualitative assessment with 39 people with disabilities and 16 caregivers. We used purposive sampling to identify and reach men and women with disabilities from Shahpara and Gaibandha. These two districts rank highest on Bangladesh multi-hazard risk level. Shahpara experiences cyclone frequently and Gaibandha experiences severe flooding almost every year. Along with survey, we conducted in-depth interviews, accessibility and safety audit, photo voice and ranking for qualitative exploration. For data analysis, we conducted descriptive analysis, and for qualitative synthesis, we conducted thematic analysis with data triangulation. Now I will explain about the sanitation experiences of people with disabilities in Bangladesh. Survey indicated that 30% of the total respondents reported damage to their toilet facilities due to extreme weather events. Most toilets were affected by flood or water clogging. Here we can see a picture of the toilet that gets clogged during floods. Qualitative findings reveal that people with disabilities applied some management strategies to cope with the damage of their toilets due to extreme weather events. One was open defecation during flood or defecating in the flood water. The photo on the right of Mahidul Islam, he has directed to take this photo during photo voice and show his challenges regarding toileting during flood, and he is the owner of this photo. He chose the quote, "During a flood, this toilet went underwater. I had to defecate in an open place or in the flood water." We can see how vulnerable the toilet is to flood, and it gets fully inundated during flood, which compels him to defecate in flood water and also raises safety and privacy concern. Another management strategy was to continue using the damaged toilet after cyclone. Additionally, using relatives and neighbors' toilets which were not damaged and limiting toilet uses also come up as management strategies through analysis. Though using alternative toilet was a management strategy, survey revealed about half of the surveyed people with disabilities could not use alternative toilets. The reason behind this were found to be their mobility limitation to reach the alternative toilet, experiencing verbal abuse, lack of accessible transport to reach disaster shelters, and through some reached shelter, they could not use those inaccessible toilets. Participants who used alternative toilet facilities also changed their daily routine or practices because of it. 50% more people with disabilities change their daily routine than people without disabilities. Limiting or restricting their toilet uses was the most reported change of daily routine among people with disabilities, and this was more common for women with disabilities due to safety and privacy concerns. These challenges due to damage of sanitation facilities by extreme weather events and the applied management strategies exerted negative impacts on the health and well-being of people with disabilities. Many reported of slipping, falling in the muddy, waterlogged paths while trying to reach toilets and sustained physical injuries. These injuries worsened their health condition and increased their dependence on caregivers to reach and use the toilets. People experiencing incontinence suffered more as the caregivers struggled tremendously to meet their hygiene needs and support them with toilets in the emergency situation. Many came in contact with urine and feces as they continued to use damaged toilets or could not clean themselves properly, which increased their risk of contracting infectious diseases.
I'm going to talk about personal hygiene practices of people with disabilities in extreme weather events. 30% of water facilities were damaged, and this disrupted people's ability to collect water, bathe as often as they wanted, wash their hands, and do laundry. And this included menstrual materials. So people coped by washing menstrual materials, bathing, and doing laundry in the floodwater. But the floodwater was contaminated by feces because people defecated in it and because the toilets overflowed during the floods. Many people we spoke to complained of skin complaints. People also disposed of used commercial menstrual materials in the floodwater. And of course, this leads to further environmental degradation. We spoke to Shahpara, who did photo voice with us. The image on the slide is hers, and it's of her sat on her bed with her daughter's menstrual materials on her lap. And she was explaining how she couldn't leave the home during the cyclone. So she had to store the used menstrual materials in the house with paper on it. And the caption that she chose for this photo is, "I gave my daughter cloths to use as menstrual materials during the cyclone, but I couldn't go outside in the cyclone to wash these." The situation was particularly challenging for those who also experience incontinence. So this photo was also a self-directed portrait by Shahpara. And in it, she stood next to her daughter who sat in the chair. And in front of them is a pot that her daughter defecates in because she has incontinence. The caption Shahpara chose for this photo was, "Cleaning the pot that she defecates in was harder during Cyclone Amphan because we didn't have enough water to wash and clean." So what they ended up doing was putting the pot on a windowsill and just waiting for the cyclone to pass. In terms of efforts to prepare for extreme weather events, people prioritised protecting their homes and livelihoods, which is not very surprising, but no organisations were working to make household sanitation and personal hygiene more climate resilient, and that was very surprising. After a disaster, 1 or 2 households we spoke to received wash packs after the floods in Gaibandha. So these wash packs included water purification tablets, soap, menstrual materials, but no one else got any wash relief, any wash support. And this was for people with and without disabilities. So in terms of the recommendations, we suggest expanding tailored options that could improve the health and well-being of people with disabilities and their family members. A couple of examples are providing the family with a climate resilient toilet, but also supporting those who can't reach the toilet by providing commodes and bedpans. Part of that would also be supporting caregivers to understand waste disposal and how to provide dignified care. Another example is supporting people with disabilities and their family members to develop disaster preparedness checklists and evacuation packs. So that might include incontinence products, menstrual materials, extra soap for washing people with disabilities, for example. Secondly, to distribute tailored wash packs in disaster responses. And this should include incontinence products and a variety of menstrual hygiene materials so that people with different impairments have a choice. But across all of these, the participation of people with disabilities and their caregivers should be mainstream throughout. Otherwise, the solutions might not be relevant. The next steps in terms of our study is that we are going back to people that we met and interviewed, so people with disabilities and their caregivers, to co-develop recommendations. So we'll be asking them what they want out of these new efforts going forward. Thank you so much for listening. We're very much looking forward to any questions that you have and discussing those.